Into the YouTube link sent to your email prior to the beginning of this media conference, which allows you to see us. Raise your hand using the feature built into Zoom. This way, I will know who to call on next. For those not using your phones to join this meeting, remember to put it on silent because it will affect the audio quality. I will now to give you an update on COVID-19 in Trinidad and Tobago.
Thank you, Minister Cox. To my colleague, to my left, Minister Stuart Young, Chief Medical Officer, ladies and gentlemen of the media, and Trinidad and Tobago. Today, the 3rd of April, 2020, is a sad day for the world as far as coronavirus is concerned. Today marks a grim milestone, a milestone that is tragic. And that milestone is that the world has recorded its millionth case of coronavirus. When I prepare the figures to speak to you, I normally do it around 8:30. At 8:30 this morning, there were 1,034,086 cases. But the real-time figure now, 2 hours later, is 1,040,499 cases. It means in the past 2 hours, over 700 new cases have been confirmed. Deaths 2 hours ago was 54,463. 2 hours later, where we are now at 10 o'clock, it's 55,180. That tells you how fast this thing is evolving around the world. Ladies and gentlemen, what is Trinidad and Tobago's contribution to these grim statistics? As of 10 a.m. today, we have 97 confirmed cases, with 49 being from one source, that is the cruise ship. Therefore, we have 48 cases out of that. To the 55,180 deaths globally, unfortunately, we have contributed 6 deaths to that total. Our numbers in terms of discharges remain the same as 1, and we have tested 701, conducted 701 tests to date. I just want to put speculation to rest because yesterday we were inundated with calls that someone in Tobago died. Do not rely on social media and rumor to pronounce death too early for me, please. It is painful for the families when we speculate about the death of someone. No one has died in Tobago over the last 24 hours. Let me just say that clearly. In marking this grim milestone, the question is, how do we as a society respond hearing about the millionth case? Surrendering is not an option. The only option is to heed the calls of the Honorable Prime Minister and everyone else who has been saying a simple message: stay home. If we stay home, we will not deplete scarce resources. If we stay home, we will not break the healthcare system. If we stay home, we will not put the healthcare system and healthcare workers who come out day after day, and I want to salute them again this morning, we will not put them under stress. We must abide by the orders, which I've been stating from day one, are meant to put a certain part of the population to sleep, into hibernation, and keep our essential services running. I also want to tell the national community that we are paying special attention to 2 categories of persons as we fight COVID. That is, 1, our framework plan, and it's not a framework, it's now a concretized plan for homes for the aged and long-term care facilities. The latest meeting held with the association representing 169 homes was held virtually on Wednesday. We have one person, one team dedicated, absolutely dedicated to seeing about homes for the aged, long-term care homes, and also children's homes. I will not go into the details here, but I want the population to do. The Ministry of Health is paying particular attention to this vulnerable group. We will be communicating in the future about the details. We are also liaising with the Children's Authority to make sure that homes that house children are also taken care of. But I want to appeal to visitors to homes for the elderly and the aged. If you love your elderly, if you love your grandparents, if you love your parents, the best way you can show that love now is to stay away from them, unless it is for something absolutely essential, because they are most, is to stay away from them, unless it is for something absolutely essential, because they are most vulnerable. Their immune systems are depressed. They are suffering from a range of chronic diseases. And the best way to show your love for the elderly is to stay home. So, ladies and gentlemen, as we mark the 1 millionth case, which is a grim milestone, the message has to be to continue to stay home. Thank you very much, Minister Cox.
Thank you very much, Terence Dialsing. I would now like to call on the Chief Medical Officer, Dr. Roshan Parasram, who will give us a clinical update.
Good morning, Ministers, people of Trinidad and Tobago. So, building on Minister's update, I'll go into a little more detail as to where we actually have the patients now. So, of the 701 that were tested, as Minister said, 97, there are 90 persons who are actually still hospitalized, one at Scarborough General Hospital. There are 9 persons in the Cora Health Facility, all ambulatory, meaning they have very mild disease. There are 80 persons in Couva, 2 in the ICU facilities, 1 being ventilated. There are 13 persons in the high dependency unit, and there are 65 persons who are ambulatory and doing very well. The majority of them are now without symptoms. Later today, we will actually be moving out our first cohort of those people to another facility with the help of the Defense Force. So at least 17 of those persons will be moved later this afternoon and taken out of Couva. And thereafter, as people become asymptomatic while they're waiting for discharge home and their testing, we'll continue to move the remainder of that 65 over the next few days out of Couva. So by way of just there's been a lot of discussion as it relates to when and where to wear masks. And again, I just want to focus a little bit on the mask wearing. So we are saying clearly, all persons who are ill, whether you are at home or otherwise, you should be wearing a mask. Persons within the high-risk groups, those who are elderly, have diabetes, hypertension, any of those illnesses, especially if you're going into supermarkets, public transport, markets, banks, you should be wearing a mask. It doesn't have to be a very high-tech mask, not N95, not even surgical mask. Some sort of simple mask can suffice. All healthcare workers should be wearing a mask. Again, there are tiers of masks that we should be wearing. Persons who are wearing N95 are the frontline persons that would be doing invasive procedures. Your infection prevention nurses and departments will guide the physicians and have been training them as to which mask to wear when. So those are basically the categories of persons that should be wearing masks at this time. The information and the virus evolves as we are going. And of course, persons will not be dissuaded from wearing masks at any point in time. If you think your personal risk is great, you can wear a mask. So thank you, and we will field some questions later on.
Thank you very much, Dr. Parasram. Let's hear from the Minister of National Security, the Honorable Stuart Young, who will update you on the issues related to the regulations and provide some guidance. And he will also speak on immigration and its operations over the next few weeks. Minister Young.
Thank you very much, Minister Cox, Minister Dialsing, CMO, Dr. Parasram. Trinidad and Tobago, today the message continues to be a simple but an essential one. And I'd like to pick up where Minister Dialsing and the CMO are pleading with us to listen. Stay home, stay safe, stay alive. Those must become our mantras at this time. Unfortunately, it appears that people are still not changing their behavior and staying home. We're asking you to please stay at home unless it is absolutely necessary. Yesterday, as I was making my way to the east of Trinidad, I found it very disturbing to see some of the continued activity and behavior as though it is normal along the Brian Lara Promenade and some areas of Port of Spain, which I understand may still be going on in other areas around the country. The police 555 number, I get a report twice a day, and we're still getting reports of persons gathering, some persons still going and trying to sneak in at bars and this type of thing. When the police have to enforce these initiatives, what it does is it draws on our resources. This really is, as we've been saying throughout, about personal responsibility and social responsibility. Please stay at home unless it is absolutely necessary. Yesterday, Minister Dayal Singh published, with the approval of Cabinet, Regulation number 7. And I'd like to just very briefly touch on Regulation 7 because it introduces a couple new concepts in our stay-at-home initiative and our stay-at-home drive, but also the dating. You would recall chronologically, sometime towards the end of March, the last 2 weeks of March, the government came out and we took a decision to close bars, to close restaurants, in-house dining, to close casinos and clubs, and also to close other categories. And that we told you, the population, that those would be closed until the 30th of April. Shortly thereafter, the government also took a decision to shut our borders, not only to non-nationals, but also to nationals entering, unless an exemption is granted by the Minister of National Security after consultation with the Minister of Health and his medical expert team. Again, the borders at that time were stated to be closed until the 30th of April. Yesterday's publication of regulation, what I call Regulation number 7, drew in Regulation number 3, which dealt with the bars, the casinos, the religious gatherings, as well as the closure of the borders into this. So when you see Regulation 7, please don't get confused. We have two categories of dates. Those categories continue until the 30th of April. The next category of initiatives, when we started to deal with essential services and taxis, etc., at this stage continue until the 15th of April. We have also added, and I'd like to just briefly take you all to it, Regulation number 3. In number 7 regulations, we are saying that during the period specified, which is until the 15th of April, a person shall not without reasonable justification be at any workplace unless it is a workplace associated with essential services, and the presence of that person at the workplace is essential. This is a point I'd like to just emphasize. Even with essential businesses, we are asking you only to bring out your absolutely essential workers. This is not just because you're an essential service, does not mean you should have 100% of your operational capacity going and your workers. You are putting your workers and the population at risk. Essential services really mean the bare essentials that you need to continue providing that service. And we are asking that the other workers continue to work from home. The second part of this sub-regulation deals with the gathering in public places. As you all know, we reduced the number of persons who can be gathered from 10 to 5 in public places. And as I said on the previous occasion, this does not mean a party of 5 and 6 feet away another party of 5. It means in any area outside of our essential services. So outside of the supermarkets, outside of the banks, outside of the pharmacies, outside of the groceries, and these areas, gatherings of 5 are now prohibited. What is also important is we also took a decision, and I asked Minister Dayal Singh to be permitted to make this announcement today as we're going into a weekend. Please know that Minister Dayal Singh, based on the medical expert advice after consultation with the Honorable Prime Minister and myself, we have taken a decision that we are no longer allowing persons at beaches, rivers, streams, or springs unless your presence there is for the carrying out of a service related to a beach, a river, a stream, or a spring. We saw last weekend persons still going to gather at certain rivers. This is now illegal, and if you're found there, you can be subjected to a fine of up to $50,000 and possible imprisonment. We continue to say that at the end of the day, we're hoping we don't have the TTPS, don't have to enforce these measures, but they will if they have to. People, it is not life as usual. I'd like to thank the banks. 2 days ago, when the Commissioner of Police reached out to me just before coming to this press conference to express concern about the gatherings outside of banks, I called all of the CEOs of the major banks and asked them to immediately implement, outside of their remaining open branches, markings, keeping the social distancing in place, and every single one of them immediately agreed, and they've implemented it. And we saw the results of that yesterday. Also, we're asking persons, unless it is absolutely necessary, please, there's no need for you to go and carry out normal business at any of these establishments. Stay home. We are also asking groceries, supermarkets, pharmacies, and other essential stores to do the same and assist with the social distancing by marking outside of your stores and while you're cashing areas the social distancing policy of 6 feet, and to listen to the advice of the CMO. Immigration. We have been looking at immigration for a while in upgrading our software and our hardware system to introduce facial recognition, to introduce biometrics, fingerprint ID, and a host of other potential sharing of information along international lines. Now is the perfect time for us to utilize the opportunity to implement these new software and this new hardware. So what I'm announcing today is until the end, for the whole of next week, the Immigration Division will be closed to the public for the renewal of passports and other of those types of services as we upgrade our systems. I'm also going to be asking Immigration to prepare, when they reopen, a new system for passport renewals in an alphabetical order. So on specific days, persons with the surnames between certain letters will come in on a Monday, Tuesday, Wednesday, Thursday. There will still be some element of emergency passport renewals. But of course, this will be worked in. So I'm asking Immigration, as we use next week to close down, to upgrade our software and our hardware to prepare this system for implementation. Citizens of Trinidad and Tobago, I cannot overemphasize what my colleague, the Minister of Health, and the CMO are saying to us over and over, and coming from as high as the Honorable Prime Minister as he addressed us earlier this week. When you look at what is going on around the world, and you see how rapidly this colorless, odorless, unable to be detected virus spreads, the safest thing for us all to do is stay at home. So I really am joining that call and that cry. Stay home, stay safe, stay alive. Thank you very much, Minister Cox.
Thank you very much. Members of the media, remember we have expanded the pool of reporters to give as much of you an opportunity to pose questions to us. But that means in our limited time, we will have to give each media house a chance to get at least one question in. So let's keep this in mind as we begin taking your questions. The floor is now open. I recognize Vern, 91.9, Tobago.
Hi, good morning.
Morning, Vern.
Morning. Vern next to 91.9 FM in Tobago, but I represent the both studios. So this is a national question. Based on the GIS that we saw yesterday presented with the map of the locations, is there any plan to do any sanitization of these areas where persons may have interacted, or based on where the contact tracing has shown? Is there any plan to sanitize the areas? And just a quick statement, if at some point we could get the Minister of Public Utilities to come in at some point and give us an update on the water situation and how our use is going, considering that we increase water use in front of groceries and places like this. Thanks.
So the Chief Medical Officer will address the issue of sanitization.
Hi, good morning. So the question, in terms of understanding the map would have shown our cases, including the Balandra cases that were imported. So there seems to be some misunderstanding about it. So those were cases that we had as imported, and they are shown throughout the country. Sanitization in terms of supermarkets, markets, public spaces would have started quite a long time ago through the use of the Public Health Inspectorate. So they have actually been working both with the regional corporations and the Ministry of Health. They have been working together for over a month, trying to get persons to understand how a supermarket should flow in terms of the number of persons inside, how we clean our trolleys, different measures that were put in place for sanitization across the board, knowing fully well that when cases come, and we discussed hidden contacts yesterday and the day before, that those areas are high risk for transmission of the virus. So sanitization became a very important concept for decreasing the risk of community spread and person-to-person spread quite a while ago. And we have used the GIS technology to actually ramp up in those particular areas. So pointedly to answer the question, yes, we have targeted areas based on our resource, but it has been done throughout the country to ensure that there is no spread.
Thank you very much. I will now recognize Stephen Cummings, 98.1.
Minister Diaz, you painted a rather grim picture when you started out, and about the elderly and person working. So now, let me first commend the Ministry of Health.
Hold on, Mr. Cummings, we are not hearing you clearly.
Hello?
Yes, go ahead.
Yes, let me just start over again. Minister Diaz, you started by painting a very grim picture of the situation, not just here, but worldwide. And, let me first commend the Ministry of Health for being very proactive, exception of this pandemic. But keeping in the same spirit of being proactive, I'm asking whether there might be measures for what many suspect would be a traumatized section of the population in post-COVID-19. Now, looking beyond this pandemic, there is a strong view as well that there probably should be trauma centers, manned by qualified psychologists and psychiatrists that we would possibly need, around the country, and to deal with some of the emotional and mental pain that I believe some citizens are experiencing right now. Is that part of the planning going forward?
Sure. So as Minister of Health, I will take that particular question. You may remember I told the country late last year that I took a note to Cabinet to approve the creation of the post of a National Director of Mental Health Wellness. And in that note, Cabinet gave me the authority to decentralize mental health. That is now government policy. That has been started to be implemented, and in that policy we are doing exactly what you, Mr. Cummings, has suggested. So may I congratulate you for thinking along the same lines. Decentralization of mental health will mean that communities will be better served with mental wellness facilities. We did not do it back then for COVID because COVID was not on the agenda, but we did see a need for the decentralization of mental health and to take the whole issue of mental wellness back into the community where it belongs, and that has already begun. So I'm glad to share that information with you.
Thank you very much, Minister. I now recognize Anna Ramdas.
Good morning.
Morning.
Morning, Anna.
Hi, good morning. Minister Diaz, and this question is for you. 2 weeks ago, you said that Red Cross volunteers, 50 of them, and nurses from UE will be volunteering to be involved in contact tracing. Are they on the ground? Are they doing the contact tracing? And I just have one more question.
Sure.
With respect to testing, research and international experts, including from the World Health Organization, has emphasized the need for rampant testing. In the United States, we have people going through drive-through testing. So why can't there be some sort of partnership with respect to local labs, private labs? And what is the guidelines for private practitioners? Like if someone goes to their GP with symptoms of the cold, or even if they're asymptomatic?
Okay. So let me just take part of the question, and the Chief Medical Officer will take another part. Yes, I did announce about 2 or 3 weeks ago that both the Red Cross, Gildeberg, has volunteered 50 volunteers from the Red Cross and 50 volunteers from the District Health Visitor Program. And yes, they are on the ground helping with contact tracing. So your answer to that question is yes. As far as ramping up of testing is concerned, I did indicate we are trying to bring North Central Regional Health Authority up to speed with testing. We are working on that. The equipment is there. What we are now in the process of sourcing are the actual kits and something called an extraction kit, where you extract the DNA from the samples. So we are in the process of doing that, and we'll be ramping that up once we get the extra kits. Some of the kits are in fact here, but we do have to get the extraction kit, which the CMO will speak about. As far as drive-through testing is concerned, that is on the radar to do once North Central is up and running as a testing site. To answer your question about private labs, I have said clearly, and the CMO has said clearly, no private lab has been certified by CARFA to conduct testing. We will only accept results because this is now a reportable disease. We must get the data, and it must be data that the country can rely on. CARFA, to date, has not certified any private lab to do testing. The day they do that, we will accept their results. But those results will come straight to the Ministry of Health. They will not go to the actual patient as per protocol. I don't know if now the Chief Medical Officer wants to add any technical details.
So just in terms of the testing to complete it, we have actually seen where we got 2 positive cases from private labs in Trinidad that were subsequently sent to CARFA, and both of them turned out negative.
Correct.
So we can see the ramifications of it. So it's a false positive result that we were getting, which probably is not as bad as if we got a false negative. So if you get a false negative, it means that somebody tests negative, they think they don't have COVID, they go about their normal life, and they spread it to everyone that they're in contact with. So it becomes extremely important that we only accept results from valid labs, which at this time it is CARFA, and they are not only for Trinidad and Tobago, they are regional labs. In terms of your question, as it relates to guidelines for general practitioners, the Ministry of Health has been liaising through the Trinidad and Tobago Medical Association as well as the Medical Board for quite a while now to ensure that the general practitioners are aware of what to do if and when they have suspected persons. They have been liaising, first of all, with the county medical officers of health at all regions, and then with the upcoming hotlines that we have, they have an added tier where they can call into the hotline to get additional advice as it will. So I think the general practitioners are in a good place at this point.
Thank you very much. Before I take a question from the media, there's a question online to the Minister of National Security pertaining to the lineup outside of a bank, and if 5 is the limit, if that applies.
Thank you very much, Minister Cox. The gathering of 5 in the gathering number of persons gathering in a public place limited to 5 does not apply to essential businesses and services. So the gathering outside supermarkets, banks, pharmacies, and any other essential service is not limited to 5. This gathering of 5 is in public spaces outside of any essential service and business. Also, just to clarify, with respect to the beaches, the rivers, the streams, or the springs, this is an absolute prohibition unless you are associated with a service connected. So, for example, there may be WASA workers who have to go on, EMA workers who have to go and test the water at certain rivers and springs, and these types of things, only they will be permitted.
Thank you very much, Minister. Are you through?
Sorry,
No?
Minister Dial Singh just pushed a note in front of me. This also includes, the prohibition also includes the religious gatherings that were previously being permitted. We just don't want people going out there, and that is part of the stay-at-home prohibition. Thank you.
Okay, thank you very much. Priya Bihari, ACP News.
Hi, good morning, Minister of Health.
Good morning, Priya.
In a release last night, the ministry stated, in reference to the person who had passed away, you stated that more investigation was needed. Is it that this person was not inside the system, meaning he was not at Cuba and he had to be rushed to the hospital? I'm asking that because I think that there's a lot of skepticism about people who would go into the system in Cuba, for example, whether their relatives would be able to have access and have information about them. Because once you go into that system, you know people would not be able to visit them. So the question is there, are you aware that there people might not want to go, might not want to report that they are ill and may not want to take a test because they will go into this system where they may be locked out from the rest of the world and they may not be in touch with their relatives and family?
Thank you for that question, Prior. I will answer part and the Chief Medical Officer will answer another part as to what is meant by further investigations. We have to understand, Prior, and you asked a very good question. The public has to understand we are facing an essential threat to life and limb and to our way of life. If this pandemic gets out of control, as it possibly has, the world is going to have to change its behavior. The world has already changed. One government has fallen in Kosovo over COVID. The Minister of Health in Netherlands collapsed in the parliament making a speech. There's another report, another Minister of Health has gone, whatever word I want to use to describe it. These are not normal times. These are not normal times. You don't beat an invisible, colorless, odorless, tiny virus by having patients welcome visitors into a quarantine ward. The word quarantine is there for a particular reason. And the question you ask gives me the opportunity to talk to Trinidad and Tobago. This is not business as usual. These are not usual times. This is worse than World War I, World War II, and 9/11 put together. World War I and World War II threatened certain parts of the world. 9/11 threatened certain parts of the world. We have 1 million cases in 200 countries. This is a global pandemic. So we have to understand that if you don't go into a facility, you are condemning your family to death. And your question gives me the opportunity to say that. If you are reckless, you condemn your children, you condemn your parents, and you condemn your grandparents to death. Now the Chief Medical Officer can pick up on what he means by further investigation.
Dr. Parasram?
So just to add on that last point, before we go into further investigation, patients may have mild symptoms. They think it is a viral illness, and you don't want to go into Cuba's facility. We understand that may happen. But we have seen cases that people wait too long, and they're coming with very severe symptoms, and they have actually died. So we are trying to prevent, if you don't let us know early on in the disease what your symptoms are, when we can deal with you well, when you are mild, and you wait too long, the ultimate end can be death in terms of not being able to manage it properly. So there's a counter side to it. Staying away too long, you need to present yourself, especially if you're in those high-risk groups, to us as early as possible so we can see what we are dealing with and make sure that there's not COVID from an early date and put the preventative medical measures in place to support your care as early as possible and prevent mortality. So in terms of awaiting epidemiological update. So basically we have put out that for a few cases, maybe 3 or 4 so far. What we mean, when the lab reports on a case, they get a lab reporting form, which is a very simple form. It basically has your name, it has check boxes, name, age, the hospital that has sent you in for testing. It would have things like signs and symptoms, fever, cough, whatever it may. There's a box on the bottom which says, this is a blank box that the physicians normally filled out, and some of them will put travel history, some of them will put nothing at all. In those cases where they put nothing at all, what happens is that the epidemiology unit, once we get a positive, will have to now go back to the primary physicians as well as the patient, if it is possible, or relatives, and ask the pertinent questions, whether there's a travel history, whether there's a contact with someone, contact with suspected case, and the contact tracing begins backward in those circumstances. So when we put out epidemiological review pending, It means that the team is now, because of lack of information on the actual form that is submitted to the lab, not stating whether there's travel or anything else, is now investigating the matter to see if there's a link or if not.
Thank you very much. I now recognize IE News. Is it IETV? Yes, IETV News.
We're not hearing.
We are not hearing.
Me now?
Yes.
Yes. Could you identify yourself?
Morning,
please?
everyone.
Good morning.
Morning. I have two quick questions.
What is your name, please?
Dina Mehes from IETV News. Sorry.
Thank you.
All right, great. So to the CMO, Mr. CMO, you mentioned just now that 17 persons from the Kuva Hospital will be moved to another facility. Is it a private facility? And are you able to tell us the area? And also to the Minister of National Security, we have observed on social media that a number of businesses, non-essential businesses, are closed off. However, some persons are offering those services in the comfort of their home. For example, barbers and hairdressers. Is that legal as well? Thank you.
Can we go to the first question?
I don't want to give out too much information at this point for obvious reasons in terms of where the persons will be moved to. As I said before, when we had a case in Tobago, those persons received death threats. Aside from to say that the persons will continue to be in quarantine because they would be still, in terms of infectivity, they will be infective until we get negative results from CAFA. So I don't want to divulge that information at this point for national security reasons and otherwise.
Minister of National Security.
Thank you, Dr. Parasaram. I love how national security always gets a blame. To answer your question, people actually this morning were messaging me along similar lines. So thank you very much for the opportunity to address this issue. I got messages on my phone this morning, exactly as you say, advertisements on social media that certain persons would come to your home to do your hair, your nails, and other so associated beautification projects, if I may call them that. At the end of the day, as the government has said consistently throughout, from the Prime Minister, the Minister of Health, the Chief Medical Officer, and myself, this is not about the enforcement of law. We're pleading with people to stay at home. Understand that this virus, the invisible virus that the Minister of Health just made a passionate, eloquent speech about, the spread of this virus is through contact. You can have the virus presenting no symptoms, so you're not feeling ill at all, not even a cough, not a fever, anything, and you can have the virus and go to someone's home, go into a space. And now we saw in the United States yesterday certain scientists talking about just by speaking too close to people, it can be spread. So understand how deadly this virus is, understand how serious this is. So we understand that people still want to continue life as normal. They need to make money and these types of things. But the answer is no. We're asking people to stay at home. Will a police officer arrest you? Is not always about the police and being arrested and the enforcement of a law. Doing those types of activities, you are putting people at risk. Doing those types of activities that are non-essential and hiding behind walls, you are putting people at risk. You are destroying what we're trying to achieve in protecting Trinidad and Tobago. So it is very socially irresponsible.
Thank you very much, Minister. Tobago, Channel 5. Candice.
Hi, good morning.
Morning, Candice.
My questions are, has the increase in numbers, increase in cases along the lines that you guys projected originally, and what's happening with contact tracing for Tobago?
Okay, so I will take the first part of the question, and the Chief Medical Officer will take the second part of the question as far as contact tracing is concerned. As I indicated yesterday, the 48 cases, when you take off the cruise ship cohort, by international statistical investigative procedures, is statistically insignificant to make projections. So at this point in time, it is difficult to say we expected this number or we didn't expect that number. However, Going forward, just to reiterate what was said yesterday, the international community uses the first 100 cases over a reasonable length of time to then start modeling where we can go with this. I will tell you that this afternoon at the ministry, we have a team of people coming in to start to look at our data. That is the 48 cases. Whilst that may be statistically insignificant to make projections, we want to start to plan ahead for where we are going with this. So we are not waiting for the 100th case. If we can make some inferences, we may try to make it. But it is not something I could take to the bank and say, this is how this thing is going to evolve. However, the message always has to be, stay home. All the questions can be answered, some not answered, but at the end of the day, if we are to prevent this pandemic from seriously affecting our way of life, our economy in Trinidad and Tobago, the only way we could do that is if society, families, individuals play their role by doing one simple thing, as difficult as it is going to be. That is, stay home. If you stay home, our projections will mean nothing. We can manage this. We can beat this. This is a marathon. I can't tell you what stage of the marathon we are in. We are in the first few miles. Are we in mile 15? I don't know. But what we have to do is to make sure when we hit mile 26.2 that the virus doesn't pip us at the tape. And the only way we can do that is if people stay home. So the Chief Medical Officer will now answer the technical part as it deals with contact tracing.
So contact tracing is basically where we have someone that was exposed or positive or suspected, and we actually tracing all the contacts, meaning personal contacts of that person or group of people. And in Tobago, you asked specifically about Tobago. The County Medical Officer of Health for Tobago is the one that is charged with that activity in Tobago, and supported by her staff. They are doing contact tracing for all the cases that they would have had. Similarly, in Trinidad and Tobago, the 8 county medical officers of health have been given, and we have heard that the Red Cross is now assisting us with contact tracing in terms of numbers of persons to assist. So in terms of the process, basically what we have, if we have one case, and let us say he's linked primarily and secondary to 5 cases, we actually ensure that those persons and their families are in strict quarantine for the entire duration of the quarantine period, which is 14 days. There would be calls to their home every single day by trained personnel, contact tracers, nurses, physicians, to ensure that they basically have no symptoms. If they do have symptoms, we test them right away in those groups. But the main thing is that any possible exposure or contact stays at home, does not leave, not a person from that house. So if one person goes out and they are a symptomatic carrier, it defeats the entire purpose. So when we quarantine a person, we usually quarantine the entire house along with them. So all primary, secondary, tertiary contacts are being quarantined at this point and followed up daily via the offices of the CMOH in Tobago and Trinidad.
Thank you very much.
Let me just make one point here. There is one national plan for Trinidad and Tobago. There is a Minister of Health for Trinidad and Tobago, and there's a Chief Medical Officer for Trinidad and Tobago. Whatever we do in Trinidad, it is also done in Tobago. Tobago is never left out. They are part of the interministerial team. Dr. Tiffany Hoyt sits on that team. Tima sits on that team. So it's one plan, one national plan across 5 RHAs for one country, that is Trinidad and Tobago.
Thank you very much, Minister. I will now like to call on Rishad Khan.
Hi, good morning, everyone. Rashad Khan, Guardian Media.
Morning.
Good Good morning.
CMO, the point you touched on there just now directly relates to my question. I just wanted to know, now I understand that you all said we don't have enough information yet to make any projections and stuff, but CMO, would you be able to tell us what is the rate of transmission within households? Do we have any figure for that right now?
So what we use for transmissibility of any virus is something called the case reproduction rate. Although we don't have significant numbers in Trinidad, we have significant numbers across the world, and a lot of research has been done to determine what the case reproduction rate is like. For this virus is just over 2.3 thereabouts. Similar viruses in that category will be something like, it's a little bit higher than H1N1 in terms of transmissibility. The household contacts are your primary contacts. So if persons in a household are, let us say there are 4 people, it means that possibly one person would be in contact, or 2 people significantly. So a household that lives together, it's a different group of people. It is very, very close contact, and exposure occurs on a daily and an hourly basis. So the case reproduction does not reflect in a household because there's prolonged exposure. But in terms of a group of 10 people meeting, you will find if they sit in a small space together without social distancing for any length of time, there's one person infected, that person will probably infect 2 persons in that space. So it gives you an idea of infectivity. We don't have to wait in Trinidad, as I said, to look at these statistics as well too much, because there's a lot of work being done in countries that have large numbers of cases, and our policies and public health measures have been put in place based on the numbers and the research related to the virus, its transmissibility, having asymptomatic carriers, having persons with minimal disease transmitting, all of those, and that's why we continue to say that you, of course, stay at home, however, behave as if everyone is infected, because it is something that we cannot see. So we have to assume that people are carrying it all around us, and that is the only way we're going to prevent spread.
Thank you. Urvashi Tiwari, TV6.
Hi, good morning, everyone. Morning to the ministers, media colleagues, and also to the viewing public. Thanks for allowing me the opportunity to ask this question. And it's posed to the CMO. CMO, have you seen or have you all noticed in the health sector an increase in the number of persons turning up with pneumonia, with severe acute respiratory distress? And I'm asking from the beginning of January to present, because if I'm not mistaken, testing would have started in late February, March. Is it possible that there could have been, therein lies those missing cases that we talk about? Also, just to point out that we noticed an increase in H1N1 cases from January to present. I think it's in the number of 68. You can correct me. But we weren't testing then, you know? So just to find out about those missing cases, and just to also point out that it was only last week that you mentioned that persons without a travel history and without contact of a person who is infected would now be tested. And if you do have time, maybe the Minister of National Security or maybe you, CMO, could speak to this. The WHO spoke to lockdowns, but they spoke to it in terms of it being a continuous cycle of you implement, measure, review, you adjust those measures, and then repeat it again. So that may imply that things don't go back to normal after April 20th. We may be in for another cycle of these types of measures. Thank you.
Right. So in terms of the other flu-like illnesses, I just spoke to my epidemiology unit before coming here to get a sense of what is happening with other viral illnesses, the common cold, H1N1, and they have said to me clearly that there's a significant reduction in all of those cases. And I think, of course, it's due to the public health measures that have been put in place and have not been implemented prior to the coronavirus. I'm not sure what you mean by the missing cases. As far as, I don't know if you're meaning the hidden cases, but basically our testing would have started appropriately by CARFA in a time prior to getting any importation of cases. We would have put restrictions in to China on the 30th of January, I believe, and China was the main country that would have had spread at that time. Subsequently to that, we would have closed our borders to non-nationals coming from 9 in total countries based on our global look to see where the disease was spreading to. I don't think there was a risk prior to that time when we began testing of Trinidad having imported cases. So, and as we have tested, even during the carnival season, there were groups of people that came forward to us and said they were in contact with persons from the US, from Canada, from UK. At the time of carnival, there were very, very, very few cases in those countries. There were less than 50 cases in all of those territories before carnival, maybe as low as 10 in US, which is 10 out of 300 million. So the numbers were very low. We have still tested those people coming out of the carnival season, and all of them have been deemed positive. Persons coming out of UK, some have even said to us they were in very close contact.
CMO, you mean positive or negative?
They were negative.
Right.
Right? So they were very close contact with people that have said subsequently went back to the US, for instance, that I know personally of. They came down with flu-like symptoms after. We tested them. They were negative as well. If we had transmission of this virus during the carnival season, we would have had tens of thousands of cases of coronavirus in Trinidad and Tobago to date. So I don't think prior to getting our first case on the 12th of March, there would have been any cases in Trinidad and Tobago.
Minister Young?
Thank you very much, Minister Cox. To deal with the question that Ms. Tiwari just raised, as you have seen by our actions since we first implemented on the 30th of January, being the first country in the Western Hemisphere and one of the first countries in the world to take the proactive measure of saying that anyone who had been in China had to quarantine for 14 days before coming to Trinidad. We continue to review what is going on. We continue to review and be guided by our medical experts, the Ministry of Health, and the CMO and his team, and we will continue to do that. There is no country in the world, there is no person in the world who can say anything definitive at this stage about how reactions and about how dealing with coronavirus is going to go, the COVID-19, and we are not dissimilar. But what I can say is we continue to be guided by our medical experts, and we will take the necessary action as we see fit, as we've been doing. There's one other thing that came up, Minister Cox. That is that we're seeing, and it was just sent to me, I was trying to find it, persons advertising again on social media, certain roadside vending, and what they intend to do over the weekend, and that they will have their stands set up over the weekend. It is worth repeating. Once again, understand this invisible, odorless, colorless, you can't see it, you can't smell it, deadly virus is spread by contact. At the end of the day, it's not about the policing, it's not about the enforcement of the law. That type of irresponsible behavior should not be encouraged by the public. You go out there to pick up your roadside food and you mingle with other people whilst waiting and try to fool yourself that is a drive-by operation. Understand you are running the risk of contracting the virus, going back home and spreading it to your whole family, your whole community. And just take a look today at what's going on internationally in the most sophisticated of countries who try to continue with life as usual, and their rising death tolls and the rising spread of the virus. And ask yourself, was that delicacy worth it?
Thank you. Power 102, Kimberly.
Thanks so much for having me. Just a quick question. Can you guys hear me?
Yes. Clearly.
Yeah. Just a quick question. So of the 97 positive cases that we have, and this question is for the CMO, do you know if any of those 97 positive cases would have come from the 19,000 who returned to our shores before we closed the borders? And Dr. Parasram, you mentioned 65. I'm not sure if those 65 would have been at Balandra. Could you just clarify that for me? And one question for Minister Young. The 30-plus nationals who we have in Barbados, do we have any plans to repatriate them? Because I know their self-isolation is ending soon. Thanks.
So in terms of your first question, a large number of the positives that we had would have come from the group of the 20,000 nationals, most of them. In terms of the Balandra, the 65 cases I spoke to are persons within Cuba at this point that are doing very well, have no symptoms. They will be taken out of Cuba as soon as we can allocate space in different facilities for them. So it doesn't speak particularly to the persons from Balandra, but it does include some of the people that would have been taken in to Cuba from Balandra.
Thank you very much. With respect to the persons in Barbados, I have been in contact. They have had lawyers reach out to me As you know, they were put into mandatory quarantine in Barbados. The mandatory quarantine ends after 14 days. When I had spoken to the Prime Minister of Barbados and the Attorney General of Barbados, at the time when this was a very live issue, I agreed, after consultation with the Minister of Health and the Prime Minister, to send test kits from Trinidad, from our supply of test kits, up for those persons to be tested for COVID. So the proposal at this stage, and I will be writing to the attorneys during the course of today, the proposal is as soon as they complete their 14-day quarantine cycle in Barbados, I'm going to ask the Barbadian authorities to test them with the kits that we send for COVID, provided they present negative and they don't have COVID according to those test kits. They will then have to make the arrangements, which I will give consideration to, for them to come here. The medical experts, Minister Dial Singh, the CMO, and their team will then advise if they re-enter Trinidad and Tobago, whether they will be put into state quarantine or not. Anyone who is permitted to come back, and our borders are still closed until the 30th of April, these are the types of decisions we're making. With the persons in Suriname, their lawyers have been in constant contact with me. I have reached out to the Surinamese authorities to see whether they can assist us in having each of them medically examined, because it's easy for people, they want to come home to say they're not presenting any symptoms, but we want medical evidence of that. So we're right now in contact with the Surinamese authorities who are dealing with it, and I'm waiting to hear from them as to whether they will assist us in having those nationals of ours there medically examined, and we take it from there. These matters and many others are receiving a priority. It's not an easy situation in Trinidad and Tobago. 2 nights ago, if I'm just very quickly say, at after 11 o'clock at night, we were contacted with a medical emergency situation from another CARICOM island, where a person was basically, at the time they were telling us, life or death. I spoke to the CMO about how we deal with it. And there are a number of decisions. Our borders are closed. So even in a life and death situation, we are being guided by our medical experts. The person fortunately started to make a recovery. But at the end of the day, it could have meant a decision to tell someone who you're being told life or death, they being a non-national, that we would not permit them to come to Trinidad if not satisfied from the medical perspective. And that makes the point that we are doing everything we can to protect Trinidad and Tobago from the spread of any COVID-19.
Nika Pasnlal, Loop Titi.
Hi, good morning, everyone. My question is for Minister Young. You touched on something I really wanted to dive a little bit deeper into, and that's nationals that we have abroad. One is that we announced that we had students who were abroad that we were organizing to get them back home. Do we have an update on that? And are we being made aware of any other Trinidadian nationals around the world that have been, COVID positive? How have they been doing? Do we know anything about what's happening with them?
Okay, I can answer the first part with respect to if we know of any nationals who have tested COVID positive. I recall seeing a news broadcast on international news sometime, I believe this week, that there was someone who may have been a Trinidadian, unfortunately passed away with COVID-19 in New York, but again, that is just anecdotal. I don't know if the Minister of Health and the CMO have any further information. With respect to our nationals, as I say, we are dealing with these things on a case-by-case basis. It was very interesting. I've been in constant contact with the Minister of Foreign Affairs. Recently, Jamaica, who have the majority of students throughout the UE campuses, Jamaica told their students, stay in place, stay exactly where you are, and what they're doing is trying to assist them. That's the best advice at this time, because anyone who exposes themselves to air travel is putting themselves at a higher risk rate of contracting the disease. I think our students are being very responsible. At this stage, they will continue to do so. With respect to other nationals across the world, when they apply on a case-by-case basis, it will be looked at. But at this stage, I keep re-emphasizing any travel and movement, in particular on international airplanes, you are putting yourself at serious risk.
Thank you very much. I'm checking to see the hands.
Yeah, TTT.
Newsday. Larissa.
Hi, good morning.
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 Hi, so two quick questions. One, how are the remaining elderly patients doing? Because I know that you all would have mentioned that thus far would have been elderly patients. And have any children tested positive thus far?
Chief Medical Officer?
Yep, so in terms of children, the answer is yes. Just repeat the first part of your question, sorry.
How are the elderly doing? How are the elderly doing?
Yeah, so the elderly belongs to the high-risk population, as we said. In terms of the cohort of people in Trinidad, when you look at the demography, the majority of them would have been 50 and above out of the 97 that were positive. So we're still stressing, of course, the measures to be put in place in that Minister would have alluded to through our task force at the Ministry to deal directly with geriatric homes. So those are our high-risk populations, and worldwide we have seen the greatest level of mortality. There's one study from Italy that shows the majority of their deaths would have occurred in persons over 60 years of age. We're seeing that trend in China as well. So it is a very vulnerable group, and we are paying very, very particular attention to that group.
Thank you very much. Peter Christopher, CNC3.
Good morning. Good morning. I'm Peter Christopher from Guardian Media Limited. I just have a couple of questions with regard to the 17 that are being moved. What would be the procedure for them going forward? How long would they be in that facility, and what would be the process if they are discharged thereafter? And a follow-up question with regards to the labs that are not certified, private labs that are not certified, what would be the process that they would need to follow to get certification from CARFA, and have any of them approach the Ministry of Health to be certified?
Okay, so the labs don't approach the Ministry of Health. The labs approach CARFA for certification. And then I will ask the CMO to answer the rest of the questions.
Right, so in terms of the process for discharge, as we have said before, so the 17 persons would have been asymptomatic, meaning they have absolutely no symptoms, they are recovering well. What our guidelines have suggested is that we do 7 days without symptoms, we do our first test. If that first test is negative, we wait 24 hours, do a second test. If the second test is negative, then that person can be released home. If the first test, however, is positive, as have happened with a few cases, we wait another 24 hours and we repeat that test. We're trying to get them out of Cuba into a different sort of environment, a non-hospital environment, because they are basically well patients. However, the reason we are holding on to them is because they are still contagious, because they have the viral particles present within them still. The only way we can know that they don't have that is when we get 2 consecutive negative tests 24 hours apart.
Let me just stay here, because we always get these questions, how long? The only way the timetable is set is not by mankind. The timetable for recovery is set by the virus. We have no control over, the virus sets the timeline, and we have to respond to that timeline. And that is why we keep saying the only way to prevent the escalation outside of these 97 cases that we have, to prevent an exponential increase in the coming days and weeks, because this is when we expect our peak, is simply the messages to stay home. I want to keep pounding that message into Trinidad and Tobago. Stay home. The virus determines the timeline. The virus determines the schedule. The virus determines the timetable. Not man, not the CMO, not the Minister of Health, the virus.
Ladies and gentlemen, we have come to the end of today's virtual media conference, and do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. May God bless Trinidad and Tobago.
92.